Did you know it was only after World War One that large numbers of Americans began to smoke cigarettes? Well, during the war, tobacco companies gave away free cigarettes to millions of soldiers. Approximately 30 years later, in the 1930s, a sudden epidemic of lung cancer cases developed and were associated with smoking. It is estimated that only that the principal cause of about 90% of lung cancer in men is due to smoking, and almost 80% in women. The American Cancer Society statistics states that over 200,000 Americans will be diagnosed with lung cancer this year. Now, by the 1970s, lung cancer had rose from being one of the rarest forms of cancer to the most deadliest form of cancer. Even though smoking tobacco products is the main contributor to lung cancer, there are also other causes, such as secondhand smoke, radon gas, genetic factors, and asbestos. Secondhand smoke is a mixture of two forms of smoke that comes from the burning of tobacco. The first form of smoke is midstream smoke. This is the smoke that is at the end of a lit cigarette, pipe, or cigar. The second form is mainstream smoke, which is exhaled by a smoker. The two forms are very different. The side stream smoke has higher concentrations of cancer-causing agents than the mainstream smoke. This form, it makes its way into the body cells more easily. Radon exposure is the second major cause of lung cancer. Radon is a colorless and odorless gas generated by the breakdown of radioactive radium, which is the decay product of uranium found in nearly all soils. It usually moves up through the ground to the air and into your home through the cracks and holes in the foundation. Then your home traps radon inside where it builds up. It does not matter the age of the home or how well it's kept, radon can still be found. The United States Environmental Protection Agency estimates that 1 in 15 homes in the U.S. has radon levels above the recommended guidelines. Exposure to radon is responsible for an estimated 20,000 lung cancer deaths each year. Another contributor to lung cancer is asbestos. It is a mineral fiber that has been used in a variety of materials due to its insulation and its fire retardant. Because of its fiber strengths and heat-resistant properties, asbestos has been used for a wide range of manufacturing products such as roofs, ceilings, floor tiles, paper products, and packaging. When materials containing asbestos is damaged or repaired, the microfibers become airborne and can be inhaled into the lungs, which can cause lung cancer and other severe health problems. Once someone is diagnosed with lung cancer, the treatment methods are determined by how far the disease has spread. Unfortunately, most cases aren't detected until the disease has spread beyond one area. If lung cancer is detected at an early stage, such as only one tumor, the option of having the tumor surgically removed is advised. But this option is based on the medical condition of the patient as well as his or her age. Other treatments that are commonly used are chemotherapy and radiation. These options come with the major side effects such as hair loss, weight loss, no appetite, and skin damaging, just to name a few. I lost 3 family members to lung cancer. In August of 2008, my dad, Erskine Shaw Sr., was diagnosed with lung cancer. It was detected at a late stage and had spread it to his back and his stomach. The doctors gave him options of having chemotherapy and radiation therapy. While going through these treatments, He had no appetite and lost over 50 pounds within only 5 months. The medications that he took, it had so many different side effects. He began to vomit a lot and he lost a lot of his hair. Everyday living became very miserable and depressing. And only 5 months after being diagnosed with the disease, he passed. The cause of his form of his case of lung cancer was due to years of exposure to asbestos as an electrician and smoking cigarettes. In 1993, my grandmother was diagnosed with lung cancer after having a bad case of pneumonia. The doctors drained the fluid from her lungs and saw an abnormal spot. After numerous tests on that area, the results came back as lung cancer. Now, she was a cigarette smoker for years. Also, my great aunt was diagnosed with lung cancer, and she was a non-smoker. She worked at a manufacturing plant for numerous years, which is where she was exposed to asbestos and secondhand smoke. During her stages of lung cancer, it spread to her breast, which had to be removed, and eventually she died from the disease. After noticing the trend of lung cancer in my family, I decided to inquire more about the disease and bring others' awareness level up. You can reduce your risk of developing lung cancer in several ways. Being aware of the statistics and illness it contracts, you can decide if you want to smoke, continue to smoke, or not. Other preventions to avoid lung cancer is avoiding secondhand smoke, because there is no risk-free level of secondhand smoke exposure. You should also have your home tested for radon gas and take the corrective actions if high levels are found. Avoid unnecessary medical tests that involve x-ray images of the chest. And last, follow health and safety guidelines in the workplace and avoid exposures to substances known to cause cancer, such as asbestos.